Okay, so welcome back. Starting with case 11, we're going to discuss some general cases, so they're no longer going to follow the pattern of being all brain tumors. We'll start here with case 11, a 35-year-old with dizziness, nausea, vomiting, and seizure. Here we see some images from a CT of the head. You have a brain window, a bone window, and then this is a post-contrast CT of the head over here on the right. Here we just have a couple more images. Just a little bit higher from a non-contrast head. So start thinking about what your diagnosis might be. Here we have some images from an MRI of the same patient. At the top left, you have a T2, then a flare, pre and post contrast, and then a coronal post contrast here. So your question is, what is the most likely diagnosis? And then your second question is, what animal is the primary host for this organism? So this has kind of tipped you off that it's an infection. This is a case of Neurocysticercosis. This is a parasitic disease involving the brain, the tapeworm Taenia solium. The other host that gets this is the pig. You get this in the gut by eating undercooked pork, but if you have a stool contaminated with ova, then you can get it in the brain. The treatment is antiparasitics, typically albendazole, and steroids are good at reducing the edema. This is one of the most common causes of acquired seizures in endemic countries such as Latin America. Now, the common findings that you'll see on CT, you'll see tiny little lesions, many of which may have old calcified nodules. You may have some surrounding edema, and then the dot inside of the scolex. On MRI, they can be in sort of various stages, but sometimes you'll see that calcification. You'll also see variable edema on T2 and flare. So here are the stages of the disease. You have the vesicular stage, which is a thin-walled cyst, a little dot, and with not much enhancement. As it becomes the colloidal vesicular, you'll develop some wall enhancement and surrounding edema. And then as they become granular nodular, then it's evolving and resolving. So the edema tends to go away and the wall is retracting. And finally, the chronic nodules are simply small nodular calcifications, often at the gray-white junction. Here you see a graphic from the CDC, which is showing the evolution of this life cycle. So you can get the oncocytes in the pig muscle. It's ingested by humans. And then the ova get excreted in the stool. And if that's eaten, then it can develop in the brain and eyes. Here I'm just going to walk you through some of the images from this case. Here you have some of the initial CT images. You see a little calcification there. It's got some surrounding edema. This is vasogenic edema because the cortex is spared. There you see just a tiny calcification there. If you give contrast on a CT, you'll see a little rim of enhancement there. So you're seeing that around the chronic calcification there. Here you see some other chronic lesions up near the vertex here. So that's telling you this person's had a chronic granulomatous infection. On the MRI, what you can see is a lesion here. It's kind of T2 dark with some surrounding vasogenic edema. And then again, on the post-contrast imaging, you have a rim-enhancing kind of cystic-looking lesion there. These are typically at the gray-white junction, which is what's going on in this case here. Here you see the same patient. They've been treated with albendazole for 2 weeks. You see the edema has resolved. All that you have left is a few little nodular areas of flare. These are just sequelae of chronic insult, possibly cysticercosis or other insult. Now, your second question was, what's the primary host for this organism? That is the pig. So we talked about that a little bit, so we'll stop there.